Well, welcome once again to Ask Me Anything on Diabetes with Dr. Aniket Banvi. Well, today we have yet another interesting that has been asked by various people. There is some delay. Okay, I'll take a pause so that the delay is gone. There is a light flickering going on. Okay. Okay, I believe the network is stable now and you guys can uh, are able to capture or hear me clearly and correctly, right? So we have yet another a set of questions that has been asked by various diabetics. Looking forward to understand what is the case scenario and what are the pain points they are going through and what are the solutions for that. Well, there is no generic solution. I will be giving you what is a broad understanding of those things. And yet again, there is an interesting question that I will be reading out now. That is, how does alcohol consumption affects blood sugar level in people with diabetes? Well, it is going to interact in so many different levels in your body, and it is going to cause a lot of havoc in your body when you consume alcohol. And let me detailedly start describing each one of them. The primary thing that you will see is dysglycemia, that is extreme fluctuation of your blood sugar level. Either it is going to raise your blood sugar level extremely, or you will see extreme blood sugar level lowering, that is hyperglycemia or hypoglycemia in this case scenario. And this is one of the drawbacks that we see when a person consumes alcohol. And the lowering of your blood sugar level or increasing of your blood sugar level is intangible with maintaining your blood sugar level. It is going to hamper your entire body's homeostasis or the normal functioning of the body, and that is very concerning part of it. That is the number one thing that we see when a person consumes alcohol. The second thing that we see specifically is the load, the burden that is being put on the liver. Also, we need to know that the liver is also an organ which helps in storing the glucose in the form of glycogen and helps to utilize it whenever it is necessary. So when the consumption of alcohol has also been seen, there has been so much of a damage that is being done to the liver organ also, and that is going to cause a lot of other complications in the near future. And hence it has been said that the consumption of alcohol has a direct impact on liver in various biological pathways, in metabolizing it, in excreting it, in so many other parameters as well. So you need to understand that when you consume alcohol, it is not just your blood sugar level, your liver, but also your nervous system is also being compromised at this point of time. And that is the third most thing. What we see, people have a loss of sensation, not just sensation, but the sensory organs are absolutely either heightened, or the perception of things around them is going to be very distorted in a various different manner. Their motor and sensory actions will be very much in a different tangent. And that is why you see when a person consumes alcohol also, he or she happens to have no control over their sensory organs majorly. The way they behave, if you see closely, any person who has consumed alcohol, they will have an issue in their gait. You will be able to see that they are not able to have a hand body movement coordination, and that is because of the nervous system is not that in the right place, in the right segment. That is one of those things. Also, it has been seen that you know the weight gain and other parameters of consumption of alcohol is seen predominantly. So by end of understanding all of these things, what we have over a period of time understood is that consumption of alcohol has never been beneficial in any manner, not even in a small quantity also. So make sure that consumption of alcohol is definitely going to hamper for any person who is diabetic. And if you are consuming any kind of medication and you're taking alcohol, there will be a drug interaction, and that will also cause a lot of complication. So make sure that you make the right choice, take care of your health, and then think about other things also. So make sure that your health is on the prior list. Please make sure that you don't consume alcohol, especially for diabetics, not just for diabetics, but everyone who is listening to me right now, because that is one of the primary reasons why we see the lifestyle diseases growing in today's time and scenario. I hope that this answers your curious questions. The next question that we have is that, can weight loss have an impact on managing diabetes? Well, this is interesting. And yes, it is going to have an impact. The moment, so you need to understand that when you say weight loss, you're you're just losing your body fat and the water retention that is there in your body. Is that what you call fat loss? What is the fat loss in the whole general term? So you need to understand that when there is a fat loss happening, you need to make sure that you're not losing, you're not losing your muscle mass as well. It is very important to understand that muscle mass is very important to retain or even to build to a certain time or certain extent. The reason I'm saying is that because muscles are essential in metabolizing your glucose. The cells that take up the glucose and utilize it as an energy in building your muscle, in utilizing, in expenditure of your energy, is all very essential. So you need to make sure that when you are in the journey of managing your weight, or you want to, if you have an excess body weight, you want to come back to an ideal body weight, where we say depending on your BMI, what is your ideal weight it should be. uh, you need to work on strength training to make sure that you are able to metabolize the glucose, not just the glucose, but also able to utilize the muscles in burning your fat in the long term. And that is very essential. And there are many other parameters that you can do. So how is it going to impact? Now let me tell you how is it going to impact. Now it is going to increase the insulin sensitivity, where your cells will be very much receptive in utilizing the insulin that is circulating in your body, and helps in taking up the glucose in the cell and utilizing it. And that is the very first thing that we see, especially. So insulin gets very sensitive, and your cells are also sensitive, and they react in a better way in metabolizing your glucose. The second thing is, you will reduce the insulin resistance. The cells that have been resisting all these times to the insulin, that process will also be accelerated, and it will be helpful in the manner. So you need to understand that the insulin sensitivity and insulin resistance, insulin sensitivity increases, insulin resistance decreases. The next thing that we see is, it is very essential for your heart health, your blood circulation, your blood vessels, your arteries and veins. All those things will be kept in a very healthy manner. When you reduce the weight, you reduce also over a period of time the cholesterol level, bad cholesterol level, the cholesterol that is not should be in excess. Any cholesterol, any parameters in the body that is excess in the body is not good for your health. So the lipid profile will also be in the right manner. Then you will be able to see the blood vessels and all those other things, where you'll be able to see the vasodilation and the vasoconstriction of your blood vessels will be absolutely in a healthy manner. You will be much more active, energetic, and will also be able to metabolize the glucose. You will also see, you will be able to manage your blood sugar level very efficiently in the long term when you go in this process. Now, by doing this, what all you get when you are when you are able to lose the weight and build muscle and utilize that muscle and keep the muscle active, you will be avoiding the various complications that most diabetics go through. And the complication that most diabetics go through, as you all know, that is frequent urination, fluctuation of blood sugar level constantly, hungerness, tiredness, all these things is going to vanish over a period of time. And the complications that you will be avoiding is also the neuropathy, retinopathy, and many other things also, nephropathy and all those things when you are losing the weight, when you're physically active. So make sure that being physically active and keeping yourself in check is going to make a big difference in the long term in managing your diabetes. So I hope that I have answered your curious questions. These were the most two predominant questions that people had asked, and here are the answers that uh, will help you in managing that. Well, also you need to understand that you need to create a right environment for your body so that it can heal itself in a right environment. So make sure that you facilitate the right environment for your health to manage your blood glucose level. And if you have any other questions that you want to ask me, or if you want me to answer certain questions, please make sure that you comment in the comment section so that I can go through them and bring it on the next series, which we'll be doing on the Wednesday, every Wednesday in the coming weeks. Along with that, we also are coming up with webinars. You can register. The link is in the description. You can sign up for the webinar. You will have an extensively of 2.5 hour to 3 hours of extensive webinar where we'll be detailedly discussing of things that a diabetic should understand in managing in the long term. And with that, I'll take a leave. Hope to see you on the next week of Wednesday at the same time in the evening, 7 p.m. See you.